you're welcome to my platform. I am Dr. Sandra and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. Today's video is about lymphangitis. Lymphangitis is the inflammation, that is the irritation of the lymphatic vessels of the skin as well as the subcutaneous tissues, the tissues just below the skin. Lymphatic vessels, by the way, are just tubes that drain fluid from between the cells. This fluid called lymph is a result of leakage of fluid from the blood vessels, and it accumulates between the cells, and the lymphatic vessels are supposed to extract it and take it back into the veins such that the veins can take it together with blood back to the heart. The inflammation, that is the irritation of these lymphatic vessels of the skin and the subcutaneous tissues, is as a result of infectious causes and non-infectious causes. Infectious causes are usually as a result of infection by germs, while the non-infectious causes don't involve germs. When it comes to the infectious causes of lymphangitis, the commonest germ that causes lymphangitis is bacteria. And this usually happens when the patient gets an injury to their skin for some reason. Maybe they have sustained some injuries as a result of a road traffic accident, a piercing. Maybe they have some skin conditions that breached the integrity of their skin. The commonest bacteria that are implicated include the beta hemolytic streptococci, staphylococci, as well as the clostridium. Parasites, for example, the Wuchereria bancrofti, as well as the Brugia malayi. Viruses, for example, the Epstein-Barr virus, as well as the cytomegalovirus. And finally, fungi, for example, the Sporothrix schenkii. The non-infectious causes are usually as a result of cancers, especially cancers arising from the breast, the lungs, the stomach, the pancreas, the rectum, as well as the prostate. So what happens is the cancer cells can spread and block the lymphatic vessels. And when the lymphatic vessels are blocked, this can trigger an inflammatory response by the body. The body can try to fight back because these cancer cells are foreign in this lymphatic vessel. The individuals that are commonly affected by lymphangitis include those that have erysipelas, individuals that have Crohn's disease, individuals that have some cancers, for example, cancer of the breast, cancer of the stomach, of the lungs, cancer of the pancreas, the rectum, as well as the prostate. Individuals that have a low immunity for some reason, maybe they have HIV, they have diabetes mellitus, maybe they are on steroids or they are on anti-rejection drugs for some reason. For example, they underwent an organ transplantation. Individuals that have skin conditions, for example, chickenpox, psoriasis and eczema, as well as other skin conditions, because this can also cause a breach of the integrity of the skin, and this can be a portal of entry of the bacteria. Remember that the commonest cause of lymphangitis is when a bacteria enters the skin via an injury or a breach of integrity of the skin. The signs and symptoms of lymphangitis include red streaks on your skin that radiate from the site of injury, the wound, to the nearest lymph nodes, especially if you have had germs infecting that wound or that site of injury. When pressure is applied to these red streaks, there is blanching, that is, the redness disappears. But when the pressure is relieved, the redness reappears. There can also be swelling of the affected area, fevers, that is increase in body temperatures, tachycardia, that is an increase in the heart rate, headaches, general body weakness, as well as lymph node enlargement. In case there is a wound, There can also be a slow healing process of the wound. The complications that can arise from lymphangitis include cellulitis, abscess formation, that is, collection of pus in a given part of the body, lymphedema, that is, the tissue swelling that results from accumulation of fluid between the cells, and this is usually as a result of either inflammation of the lymphatic vessels or obstruction of the lymphatic vessels. So the lymphatic vessels cannot extract the lymph. Remember the fluid I told you that leaks from the blood vessels and then it settles between the cells. So when the lymphatic vessels are inflamed, they are irritated, or they are obstructed by maybe cancer cells, this fluid cannot easily be extracted back into the veins, so it is taken to the heart, and so the tissues swell, and this condition is called lymphedema. The other complication is sepsis. Sepsis is as a result of the body's reaction to the presence of germs in the tissues as well as in the bloodstream, and it is usually as a result of the cells of the immune system producing some chemicals that cause a widening of the blood vessels, especially the arteries. When the arteries widen, this can result into a reduction in the blood pressure, and this also causes a reduction in the volume of blood, the amount of blood that goes to the vital organs, for example, the kidneys, the heart, the brain. And because these organs are not receiving oxygen and blood, their cells die off and these organs can shut down. And this is the reason why these patients can die. In majority of the cases, the diagnosis of lymphangitis is clinically made, that is through history taking and clinical examination. But we can as well carry out some tests. We can do a complete blood count, we can do tissue cultures, blood cultures. These can help us ascertain what germs are causing the lymphangitis, so that we can tailor our medications to that causative germ. We can as well do a discharge study, because majority of the time these patients have a wound. So we can pick off a sample of the pus from the wound and we can carry out some tests. We can do culture sensitivity, gram staining, Zn. We can as well do some molecular techniques, for example, PCR and ELISA. And this can help us identify the germ that is causing the lymphangitis. Imaging modalities, for example, the multi-detector CT scan can also be done. When it comes to the treatment of lymphangitis, we can employ supportive management and definitive management. In supportive management, we recommend resting of the affected area, elevation of the affected area. For example, if the lower limbs are the ones that have been affected, we recommend that you elevate the lower limbs. We also recommend the non-steroidal anti-inflammatory drugs. They can help relieve the swelling and the pain. We also recommend the glycerin magnesium sulfur dressing. The definitive management of lymphangitis is dependent on the cause. For example, if it was caused by bacteria, we can employ antibiotics, for example, penicillins like cloxacillin, flucloxacillin, dicloxacillin. If it was caused by a virus, we can employ antiviral drugs. If it was caused by a fungi, we can employ the antifungal agents. And for very sick patients, especially those that have sepsis, sepsemia, we recommend that they be managed from an ICU, the intensive care unit. The take-home message is the commonest cause of lymphangitis is infection of the wound by bacteria. Lymphangitis spreads quickly, and within less than 24 hours, the bacteria would have spread from the initial site where the wound is to the rest of the lymphatic system, and it can easily get into the bloodstream. When left untreated, the germs that are causing the lymphangitis can enter the bloodstream and cause a life-threatening condition called septicemia. Septicemia can cause a reduction in your blood pressures, as well as a reduction in the amount of blood and oxygen that goes to your vital organs, for example, the kidneys, the brain, and the heart. And this can cause your organs to shut down, and you might easily die if you don't seek urgent medical attention. If you happen to see the signs and symptoms of lymphangitis that I laid out earlier, please show up to the hospital for prompt treatment. This can help prevent the complications which are life-threatening. Showing up to the hospital earlier can also help us investigate other causes of lymphangitis, for example, cancer of the prostate, cancer of the breast, the lungs, the pancreas, the stomach, and the rectum. That is what I had for you. Thank you so much for watching. Please share my videos and also subscribe. See you in my next video. Bye.